Hi everybody, what we're going to be discussing today is what to do after removal of sutures, meaning that we're talking about applying Steri strips. Now Steri strips are these little tiny guys, you'll see in a second, that look very similar to kind of those butterfly bandages you probably had before when you cut yourself. What these things do is once the stitches come out, realistically the skin is about 60% its normal strength after about 2 weeks. We put these on because it gives a little added strength after those stitches come out. Alright, so first and foremost, this line is going to simulate an incision. The stitches have already been taken out. And what you're going to do is you need them across just several centimeters on either side. So these actually are pretty long. You can actually cut the strips, little excess there. And what you'll do is you'll take these, and while putting a little bit of tension, you're going to pull across the incision and push them down. Now for some patients, if they have really sweaty feet, okay, what you can actually do is put some tincture of benzoin, which is a type of glue we use in the skin. Now in this situation, we grab some more strips just so I can show you what this would look like as the final product. There's not many more. I mean, I can use these, I guess. These aren't as long as I'd like, but in the interest of not wasting too much, we can definitely use those. But realistically, you want those to cover, see there's very small spaces between them, all the way the length of the incision. Now they should all be about the same length, so if you have to open another pack, that's fine. I'm okay with that. In situations where the patient has really wet skin, what you're going to do is you're going to take a little Q-tip, okay? The Q-tip you're going to dip into this beautiful bottle of benzoin, okay? You don't double dip, alright, but what you're going to do is after you take the cap off and you do a little dip on either side of the incision, not over the incision itself, but around the sides, you're going to rub where those would be contacting the skin. And just a thin layer, and it'll dry slowly, and what that does, it helps that to stick very nicely. Now when you put this on a patient, typically, obviously, they're going to be going back to showering the next day. They can get these wet in the shower. They will slowly fall off over the course of about 3 to 4 days. What the patient should not do is if it's just a little bit loose on one side, tell them to leave it in place. The only time they should really be removing one if it's completely loose to one side of the incision, so it's not crossing that incision line at all. In which case they can just peel that off. Typically I tell them to pull with the direction of the incision so they don't tend to want to gap that area. If they want to have a bandage afterwards, what we can do is typically if it's a small incision like this, you just take a little piece of Telfa with the adhesive on it, as long as they don't have a skin irritation with tape, and that's an important thing too to ask, because if the patient has that issue, they're going to have that irritation with these little adhesive guys, or if they have just any allergy to any adhesive, not just Band-Aids, even that tincture of benzoin can bother their skin. But you would just use this to cover up that spot. Advise the patient they can cover the incision at home with a similar bandage if they like. But they can definitely at home, but basically at home they'll fall off for about 3 or 4 days. When they do, you don't have to put anything on there, and then at that point, if they've been given instructions for applying Mederma cream for scar or some kind of scar cream, they can start doing it at that time. Okay, and that's Steri strip application.